And we are back, gentlemen. We're talking about the opioid addiction and your story, Dr. Kishore. Bob, I want you to talk a little bit about your story. And you're an associate of Dr. Kishore's.
Yes, and I'm very pleased to know Dr. Kishore. He came into my life at a time when I was concerned about my own family and neighbors who don't know that they don't know.
Right.
About what happens to people when they choose, a little wine every day can kill you. And I know a Sloan fellow who was a high-profile Sloan fellow from Sweden, and he's no longer with us. And his son is absent life as well. And I've seen too many terrible things go on. And when I met Dr. Kishore, he told me that he went from New Delhi. Dad took him to school, and it was a school where they had the nuns from France. Wow, that hit me right here. Mm-hmm. I'm a St. Gregory's 49er.
Yep.
And Sister Alice Josepha told us upon graduation, you boys are special. You're the 49ers. So we had a 50th reunion in 1999. We've had one every 5 years since. And today, St. Gregory's is called St. John Paul II Academy.
So you come from St. Greg's Parish?
That's right.
Okay.
My dad was the personal carpenter for John B. Hines.
Oh, great.
A family that were...
So you got Boston roots?
Yeah, absolute. And when I was 12, I lost my best friend, a Norwegian boy, Earl Roll. Mm-hmm. He called himself a Protestant.
Oh, okay.
Today, I don't call him that. I would say, no, you followed the direction of your family as Lutheran people, and his father was a metallurgist. My grandfather was a metallurgist. His father was a meteorologist, and he had an accent. And on Sturbridge Street in the Lower Mills, there was the Irish end and the Italian end,
right.
And in between everything else.
No, I know a little about
the
that, having grown up in Quincy.
Yeah, City of Presidents.
That's that.
So I had a pretty good understanding about, from the nuns at St. Gregory's, who made disciples of us. They were disciplinarians.
Yep.
And what I wasn't getting at home because of alcoholism in the house, which I knew nothing about, my poor mother would be there waiting for Charlie, my dad Charlie, God rest his soul. He was resurrected from the dead by the miracle of the 20th century, AA.
Okay.
He was
An excellent group, yeah.
Led there by Morris J. Downey, a BC double eagle, a man after my own heart. I wanted to go to St. Greg's in 49. Mm-hmm. I got there in 86 at Al-Anon.
So you've had some addictions. You've dealt with it in your own family also. Right. And then Dr. Kishore was helpful.
And because of the connection I made with the Sisters of Notre Dame de Namur, he had them in India, New Delhi.
And
we became brothers.
They're unsung heroes. They've done incredible work.
Absolutely, yeah.
Now, obviously, it's more than alcohol now because we got the D, drugs.
Oh, yeah.
And at this point, it's become, it's even more than that because the old-fashioned, I don't want to say old-fashioned, but marijuana back in the 1960s and 70s is now mixed with more potent drugs.
That's right.
And, the stuff that you're getting on the street now, you don't know what it is. So people are, becoming addicted to this stuff. And then we have this establishment answer to that, which is to put them on other drugs and to create clients. Dr. Kishore had an organic way to help people get off these substances. And it was really treating the whole person. It was similar to AA in a way, but it took more, it was in a sense, what I see is a more hands-on thing because drug addiction needs that.
Right.
And you, at the peak of your work, which was mid-2000s, were treating thousands of people in this state.
Right.
Tens of thousands of people, I don't know.
We had 250,000 patients in our practice, 52 centers. Each center had 10,000, 15,000 patients. So we had a pretty large practice. And they were coming in. We had 800 new patients a month into our practice.
And it was growing.
It was
At
growing.
the time that they shut you down, if they hadn't shut you down, not only would that practice have grown in this state to really reach practically everyone who had had addictions, but it very well was poised to go national. It would have
right.
been a national model for drug addiction. We wouldn't even be talking about this massive drug problem today.
See, addiction, you got to take the approach. People go to the sea to have a little fun in the surf.
Right.
If 100 people go to the beach, 92 will come back, 4 or 6 may not come back. They may get bitten by the shark, or they may have a Charlie horse and sink to the bottom, or riptide may take them to the... So we need lifeguards every few hundred yards. So that's what I adopted that approach. People do what they want, governments do what they want, but we got to take care of the families, the communities, in a safe way. So, and each community is different. No two people are alike.
Sure.
No two communities are alike. So we adopted very community responsive care, community oriented care. So my clinics are from Martha's Vineyard to Pittsfield. Each one has its own fashions, the way they treat it. Some clinics wanted us to be open 7 days a week, Springfield, Brookline. So we kept them open 7 days a week. The families wanted to come after working days. They are middle-class families.
Right.
So they wanted access. So certain places they wanted by appointment. Certain places they wanted certain services, acupuncture or... So we catered to the communities. We adopted their likes and dislikes. And we treated them like they wanted to be treated. And that's made the difference, big difference.
Yeah. You were treating people as individuals, and you, as you say, you were specifically tailoring the service to fit the needs of a given community and a given culture. And this includes people of all economic strata. This is, this is an addiction that affects everybody.
Very true. And we were first on the cusp. See, for the very high end, people go to Betty Ford Center. They can afford $90,000 for a 30-day stay. It's $3,000 a day. For the very poor, the state has a pretty decent public health system.
Right.
It's the middle class, the working stiffs, who are basically, they don't have the will and wherewithal to either to spend money or to send their children to the public detox centers, which won't take them anyway. They have private insurances. And this is the group I cater to.
I see.
This is a strong backbone of the society, the working people,
Yeah.
their families. If we don't safeguard them in the cupped hands of safety, we won't have a society.
Now, you talked about earlier the fact that there was a major drug addiction problem in this country in the early part of the 20th century, and that it was addressed by the Washingtonian system.
Right.
You are taking that Washingtonian system and replicating it for today.
Exactly right.
Now, that was a system that around 1915, 1920, it really helped the country rid itself of these addictions to cocaine and other substances.
They did very well.
Yeah.
Just an hour ago, I was at Harvard listening to a doctor who was presenting his data from 1900s. At that time, we had a smaller country then, in 1900s, but hundreds of thousands of addicts were there.
Right.
And the moment the law was passed, the numbers dropped. You can see graphically. By 1916, 1918, we had a sober country. And then we stayed like that till 60s.
Well, you had prohibition also.
Little prohibition, but it didn't last too long.
Right.
12, 13 years. But for the most part, I think the shock effect of the Harrison's Law, the DEA, Drug Enforcement Authority, FDA, make sure the products are safe. Right now, there's a drug on the street called fentanyl. And it's not coming from doctors' offices. It's coming in container ships from foreign countries like China, South Africa, where it's manufactured wholesale. And that is a whitish powder. And that they're mixing that with heroin to create special brands of heroin. And this is what's killing our people. We are losing about 5 to 6 people a day in this state. That's just unconscionable. We can't.
And that's
condone it.
something that's probably going to increase in terms of coming into this country. And highly addictive substances. We're not doing anything to treat these people. I mean, first of all, we have to do something to stop it from coming in.
Right.
And I think that actually the government is trying to do that. I mean, so I support that. But the fact is that these are, you have, as you say, whole communities that are now addicted, that are wasted, and that people are unproductive, they're suffering. And you've got this octopus-like many-armed industry there basically feeding off of this and profiting off of it and not really helping people get off of it.
The goal is to make it into a chronic disease, maintain them on methadone. Mm-hmm. See, once addiction comes into the body, normally people live till 74. Average human adult in this country, 74, 76.
Right.
So they lose about 20 years of their useful life. They're dying in their 50s. And before the death, they're not productive.
Right.
So they get on Social Security disability.
So this helps the welfare establishment.
Right.
That's this whole cottage industry around drug abuse that it started growing, I think, in the 1960s and 70s, and now it's something that it's a huge part of the national budget. You've got all these experts out there. Do we have a call? You have all these experts out there, basically coming in and keeping these people essentially on these substances, and it's horrible. I mean, it's like they're guinea pigs or something. And they're not doing. I mean, what you've advocated here is just basic common sense in terms of actually getting people off these substances. I mean, haven't we been able to expose this and show that people on these drugs are not getting off of them, in spite of the fact that we're spending hundreds of thousands of millions of dollars $100,000 per person?
That's true, because methadone costs about $20,000 a year to maintain a person on methadone. But it's a lifelong maintenance. They'll take it for 10, 15, 20 years before they pass away. Mm-hmm. So it's a $250,000 to $500,000 in dollars from the state exchequer for these companies, private companies that are selling methadone. So it's an expensive business, it's a big business. When I came to this country in the 70s, we had only 4 or 6 methadone clinics. Right now we're close to 60 methadone clinics in the state. Mm. But the population has not grown proportionally. It was 6 million in 1970s, it's 6.2 or 3 million now. So the population remained the same, but the number of clinics have gone exponentially.
And along with those clinics are all these other social service agencies that essentially manage and feed off of the very problem that they've perpetrated, that they've encouraged with this sort of perpetual addiction. And then you have people, obviously, who are involved with, because to keep up their addictions, they resort to crime. And then you have more agencies coming in to try to address that. So you have, this whole kind of welfare industrial complex, I guess you might say, to paraphrase Eisenhower's comment mm-hmm. about the military industrial complex, and that it's become an institutionalized thing. Right. And that basically it's a small c corruption. It's really an immoral abuse of people. They're not getting anybody off these drugs. They're just replacing the drugs, right. And then they're keeping them in a condition where they can continue to
Just take the example of Narcan. We had 1 ampule of Narcan in our emergency kits when I was practicing. It's $1, $2. Then they had this nasal Narcan, which is $20 to $70. Mm-hmm. And then you have like an EpiPen, injectable Narcan, that's $400 to $700. And because moms and dads are concerned about their young child who is a heroin addict or a OxyContin addict, they're buying these wholesale and keeping them in the car trunks, in the back seats, in their bathrooms. And unfortunately, a lot of these have expiration dates. Narcan has an expiration date of 6 months to 1 year. So right. They got to buy the whole thing again, or it's useless. Mm-hmm. So now a lay person is administering it, not a doctor or an EMT or a paramedic. It is administered by people who just go for a couple of hours of training. It's not so much a training, but you got to apply that drug to the right circumstances. It won't help a person who overdosed on sedatives like barbiturates, benzodiazepines. It won't help them, but they can die too. Barbiturate type does. Whereas if it's opiates alone, it helps. Fentanyl, it won't help. Fentanyl is a longer acting drug.
Right.
So you got to repeatedly give that injection. They don't have the full understanding of how it works.
I see.
So we got a problem with the delivery systems. The person who is comatose will have secretions in their nose. So to give it in the nose, sometimes it's hard. Expiration date might be there. Or some of these chemicals are light sensitive. If you keep them in the back seat of your car, the sunlight might make the molecules ineffective. So people don't know the do's and don'ts. And now it is a mass market. We don't need a physician's prescription, so people are buying it.
You can just buy it over the counter?
Over the counter. Because there's no prescription involved, they charge the full retail price, $400, $700.
What would you tell Governor Baker right now if you could get a meeting with him, or Mayor Walsh? Mayor Walsh, of all people, should understand this because he's dealt with his own personal addictions, and he seems quite sympathetic.
Right.
He's known people who have died of overdoses. I mean, I would think that we might reach out to him, or you might reach out to him.
We should. It's a crisis proportions right now. This opioid epidemic is a crisis. Everywhere you sit in a Dunkin' Donuts, people are telling the stories about losses. In the studio itself, there are people who are voicing the losses they're experienced. Young people shouldn't be facing death. And this is what we are seeing. It calls for a new action. Obviously, we tried different solutions. They didn't work. So it's a time for new solutions.
And I'd like you to introduce this to the governor. I mean, what can we do, like as a proactive thing as citizens hearing this program to reach out to our state administration and try to get them to do something?
We need a citizens' petition.
Okay.
We got to petition. It's democracy. Voice of the people is voice of God. We got to get the people to understand the current systems are not working, and pouring money into a system that's not working is not going to help anybody. We're giving them a false hope.
Right. Is there any particular website, phone number that you want people to look at in terms of websites?
Currently, I'm not practicing, so we are developing healthy communities. Bob is a builder previously, and I'm a physician. We want to create healthy communities for the future. The one good thing I saw today in the Guardian newspaper is young people are shunning alcohol and drugs.
And they're going for orange juice.
Orange
I
juice.
saw that article. Yeah, that's great.
So there is an element of hope.
Yeah.
But they can easily be contaminated if they don't have proper housing, proper safeguards, and proper schooling. So we got to think of one generation is wasted. So at least the future generation, we've got to keep them safe in the cupped hands of safety.
And you, as you said, you have a book coming out. What are you, now that you've been through this horrendous experience and you're freed, what are you up to? I mean, how are you? How are you?
Well, most important thing, as we are discussing now, is the policy issues. There's no point, if there's no political will, no person can do much. How do we create the political will? People have to rise up, they should demand answers, demand solutions, and demand a new look at this constant nagging problem. It's not just an epidemic now, it's a pandemic.
Yes, it is.
In a disease, you can have things that happen in small communities like Chipotle, then it will go away. Then you got epidemics, which happens to larger communities. Pandemic, it's whole nationwide. All 50 states are equally affected. So it's a much larger problem than any one person can solve.
Now, Dr. Kishore, you, unfortunately, since your clinics were shut down, there were no clinics in the state that offer what was the Washingtonian system, which you modernized and brought to people and saved people. Given that fact, what can someone do now? Like, let's say you have a drug-addicted son or daughter. Let's say you have a drug-addicted friend or colleague. Let's say you're drug-addicted yourself and you're watching this program. Unfortunately, they can't go to your clinic because you were shut down by the state. So what can they do in terms of bringing some of the elements of your program into their life?
Number one, when you don't have one right answer, any answer is a good answer. So lots of times, snake oil is sold. So buyer beware. They got to do their own research before they put their son or daughter into a particular program, because all programs are not alike. Some of the programs is where the dealers go to, that's where their customers are. So they got to be very careful how they safeguard their children. Number two, they have to be more vocal. We hear these stories about children dying, and then the obituary they put in, my son died of heroin addiction.
Yeah.
That's too little too late. It's good for maybe other person, but we have to be proactive. The moment you see the signs of problem, you got to roll up the sleeves and help. Addiction is a young adult problem. They start at the age of puberty, 11, 12, 13. So you got to safeguard them at that nodal point. They got to have safe places to be, moms and dads in their lives. They got to have healthy peers, healthy schools. And they got to have a positive outlook for the future. They got to get into avocations where drugs are not part of the equation. Certain places, if you don't do drugs, you're an outlier. You don't drink, you can't interact. So they got to have healthy groups, healthy places to meet. Like we're talking about the Guardian story today.
Yes.
People have to develop the social networks. So addiction is biological, psychological, social, spiritual illness.
Yep.
So Bob and me, we're trying to create communities in Missouri, Arkansas, where we can put in healthy communities where people can go together and live there.
So you're actually trying to do this in other states where there would be like a home that people can go who are drug addicted. You might say they're Dr. Kishore clubs, right? Or maybe Washingtonian Dr. Kishore clubs. I would think that maybe even in our state here in Massachusetts, even though you've been driven out of the business, people might form their own Washingtonian clubs. People who have addictions or people who know people who have addictions can get together and start to discuss at a regular basis some of these methodologies that you've employed. And that hopefully when your book comes out, that could be like the AAA book, the 12 steps. I mean, something similar to that in terms of actually taking a look at the whole person and getting people, through the sickness and then more toward health.
I think it's a point well made. I think this is how grassroots revolutions start. People have to gather together, bring people into their dining rooms or living rooms and talk and be open about it and come up with concrete solutions. People are trying it. There are coalitions formed, but some of them are infiltrated. So.
Well, I'd like to see, first of all, it would be great if you could develop a website or something where you could actually start to articulate these principles, in anticipation of the book, so that people can look at this and form these clubs and get together and begin to not only get through the sickness, but free themselves from this despicable industrial complex that is treating people like they're,
commodity.
A commodity, which is what they are to them, and begin to treat people like human beings. And as you say, it is a total treatment. It's more than just getting the free from the drug. It's spiritual, it's emotional, it's all of it. So I hope that when I have you back, and we'll do it again, and I hope that you're doing some other programs as well, you can begin to develop something like that which is accessible to people and which, like something that's at least semi-organizational that will lead to a spontaneous development of these Washingtonian Dr. Kishore clubs. So
thank you. That
would be really a great thing. And I appreciate your work and I admire what you're doing. And Bob, you too.
Thank you.
So, anyways.